Alrighty. So my name's Harjeev. I'm a fourth year behavioral neuroscience here at UBC. I work with Neuroethics Canada as well as the Addictions and Concurrent Disorders group. I'm also an incoming graduate student this fall in neuroscience, and I'll be doing some work with neurology, with addictions, and with community centeredness. So I'm very excited to be talking with everyone today, and I will pass it on to Gurkirat to introduce himself next.
Hi everyone, my name is Gurkirat Singh and I am a third year UBC student majoring in chemistry. I am South Asian Youth Mental Health Ambassador with South Asian Mental Health Alliance, and I'm also founder of Team SOUDA. Team SOUDA stands for Students Overcoming Substance Use Disorder and Addictions Society of Canada, and I'm also a research assistant with Dr. Natasha Puri studying substance use patterns in Punjabi international students.
Hi everyone, my name is Kulpreet Singh and I'm the founder of the South Asian Mental Health Alliance. It's a nonprofit society that does advocacy work for the South Asian community around mental health and substance use and youth skill building. In my day job, I work with the South Asian Health Institute in Fraser Health, and I also volunteer as an advisor to SOUDA and to One Voice Canada. It's great to be here, and I'm joining you from the unceded ancestral shared territories of the Kwantlen First Nation. Thank you.
Thank you so much, Kulpreet and Gurkirat, for your introductions. I will begin sharing our presentation. I could just have a moment. Alrighty, so again, thank you for joining. We'll be discussing today the importance of cultural considerations and factors in addressing substance use and overdose crises. And we'll be sharing some insights from an emerging crisis here at BC in our South Asian community. So I'd like to start by acknowledging that UBC is located on the traditional, ancestral, and unceded territory of the Musqueam people. And given that our conversation today will be focused on the overdose crisis in BC, it's important to recognize that the Indigenous communities here in BC are among some of the most disproportionately affected by this crisis, and any efforts to address this crisis must be anti-colonial, anti-racist, and mindful of the needs of Indigenous groups. Many of us here might know that BC is currently, just as of 4 or so days ago, in the 8th year of a toxic drug overdose crisis. And this was declared a public health emergency by the public health officer here in BC in early 2016. We can see here that in just the 3 years between 2013 and 2016, there was a near threefold increase in overdose related deaths. And this crisis has continued to worsen as we see this timeline over here. And since 2013, we've actually had now a 7 times increase in deaths relating to toxic drug overdoses since 2013. Since this public health emergency was declared, over 11,000 deaths have occurred. And as we can see here, over 40% of these lives lost were just in the last 2 years. And the coroner's report that was published on the 7th of March of this year, so just about a month ago, showed that in January 2022, 211 lives were lost to overdoses. And this is pretty consistent with the last couple of years, and that shows that this crisis continues to worsen. The coroner's report is very important in our context because it addresses and identifies the various factors that are involved, that underlie the overdose crisis, including the age, sex of the individual, health service delivery, drugs involved, township. So all sorts of factors that outline where or paint a bigger picture of what the issue is at hand. And they report very succinctly on these categories. However, this report doesn't include data related to the affected individual's race, ethnicity, culture, or citizenship and immigration status. And this is unfortunate because ignoring this type of data plays an important role in sort of neglecting the populations at hand. So all of these unreported data categories can differentially affect an individual or group's vulnerability and outcomes within the overdose crisis. And the neglect of this ethnocultural data can present as neglect of entire populations of people. An example of this neglect is within the South Asian community. As we can see from this headline from January this year, it's reported that international students are dying from overdoses at an alarming rate, and that BC's government isn't tracking this problem. Throughout the rest of this presentation, we'll shed light on this issue and discuss some related sociocultural considerations. And for further context, these international students, the headline is referring to Punjabi international students living in the Lower Mainland. While this population and more generally, the South Asian population in general is overlooked in most official reports and news relating to the overdose crisis, local faith leaders and community members have noted increases in overdose-related deaths within the South Asian community. As one Sikh faith leader reports, 80% of all reports that he receives of Punjabi international students dying while in the Lower Mainland are actually drug-related. Another report states that there are anywhere from 1 to 2 deaths per week among the international student population. Considering that on average, nearly 7 people die every day of overdoses in BC, this figure is alarming. Now, all of this report is anecdotal and it comes from community members, and we can't conclude necessarily that these are the exact numbers. It certainly is something that should be further investigated. Unfortunately, the lack of data transparency and reporting makes this really difficult. So the BC Coroner Service insists that this data relating to the ethnicity of those who died of overdose isn't collected because, as they say, there's no provincial standard for this type of information. But this can be called into question because, as we can see here, the First Nations Health Authority does an excellent job of reporting data related to overdoses in the First Nations communities. And they collect this data and publish it monthly, what's called the Community Situation Reports. And these highlight the extent of the overdose crisis as it relates to First Nation communities specifically. This figure is from September 2022, and it shows that First Nations people are dying of overdose at over 5 times the rate of other BC residents. Which again highlights the disproportionate impact of this overdose crisis on Indigenous populations. And this community situation report also actually shows us that there are examples of meaningful data collection and reporting that can and should serve as provincial standards. Another example comes from the Fraser Health Authority itself, where a 2019 Chief Medical Health Officer's report was published to contextualize South Asian people within the overdose crisis. They first reported on demographics and shared that Fraser Health Authority is actually responsible for nearly 75% of BC's South Asian population, and 61% of them reside in Surrey, Abbotsford, and Delta. And this is important because, well, this figure can sort of give us the context for that. So, this chart reflects data pulled from the 2022 BC Emergency Health Services report, which indicated the number of toxic drug poisonings or overdose calls by region. And as we can see here, both Surrey and Abbotsford are among the top 5 regions from which these calls are made. And then when we put this data together, we can speculate at the very least whether such a high volume of calls from these regions might be correlated.
Thing anyway, so fine. Thank you. Mine is, yeah, I think Ari was having troubles earlier.
All right, if anyone's able to mute that, please.
Bye, have a good evening.
So basically, we're trying to figure out whether this is correlated with the majority South Asian population makeup. And this report was important because it also shared some really important data that can give us a better idea of how South Asians are affected by the overdose crisis. So they documented an increase in drug toxicity deaths among South Asians at nearly 2 times the rate of non-South Asian people in Fraser Health between the years of 2015 and 18. And they also reported that South Asians were 1.7 times more likely to have fatal overdoses compared to non-South Asians in the Fraser Health region. They also found that, interestingly, the proportion of deaths that were predominantly male was 97% compared to, as we see here, I believe 66%. Yes, so we can see that there is a clear difference in how these situations are presenting themselves on a sex or gender basis. And this report, like I've mentioned previously, is important and necessary to understand the impact of the overdose crisis on the South Asian community, but it comes with limitations. So for starters, it only encompasses individuals who've previously had visits to the Fraser Health hospitals involved. So it's not necessarily comprehensive, and it may have overlooked individuals, for example, who didn't seek care to begin with, for example, for stigmatization, or for individuals who were maybe affected by financial barriers to seeking care. Another limitation is that this data actually is processed algorithmically. So all of this ethnocultural data is not necessarily pulled directly from databases in a 100% accuracy way. So as this report outlines, and I quote, name-based algorithms use linguistic, religious, and cultural naming patterns to estimate ethnic origins. Sorry. So while helpful in the absence of administratively collected data, this algorithm isn't 100% accurate, and resulting reports should be evaluated with this fact in mind. So generally, I would say that that this alludes to a larger colorblindness and cultural blindness problem that BC has as a whole. And although this report was valuable, no other report has been published since then. So there's a clear need for more data transparency and for further communication about the landscape of the situation in BC. For a brief overview, colorblindness basically suggests that all people should be treated equally regardless of their color or race or ethnicity. And although it's a non-discrimination effort at face value, it's actually counterproductive because it will perpetuate race-based discrimination on the basis that races and differential racial experiences are completely invalidated and denied to begin with. So it prevents actions to counter such inequities. Cultural blindness, on the other hand, is basically the inability to understand how people who are of different cultural backgrounds might view and engage with different issues. And this is a problem because it assumes homogeneity and likeness across all populations, and there's usually a preferential consideration of the dominant culture or cultures in society. And in the context of this overdose crisis, cultural blindness can and does result in a failure to recognize cultural differences, and therefore prevents culturally relevant services and care. And both cultural blindness and color blindness have significant consequences for clinically vulnerable populations. As we saw previously, the vulnerability of certain populations might be completely overlooked and further marginalized as race or ethnicity-based data isn't collected or reported. The Fraser Health Authority report also shows that there are consequences to this. As shown here, although 80% of individuals in the report were diagnosed with at least one substance use disorder, only 33% of them engaged in treatment or sought it to begin with. And if they were offered treatment, many would decline them or would decline the use of or deny that they use services to begin with. So the report speculated that this might be because the individuals perceived the available care and services as culturally insensitive, inappropriate, and or irrelevant. Cultural incompetence in the available care and services might be a result of this neglect of cultural factors when designing health provisions for addressing the overdose crisis. And stigma, for example, is an example of this. It's a major factor that presents itself uniquely in the South Asian community. Mental health issues are generally invalidated, and specific to substance use and disorders, there's a strong adherence to this sort of moral model that assigns value of good or bad to the individual. And as some of us might have witnessed or experienced, even the families of the individuals using drugs. So this can potentially explain the lack of admission of use and also the hesitation in accessing services. Language is another really important neglected cultural factor. So it informs meaning and framing of issues. And having care that is linguistically inclusive would help with knowledge dissemination in the affected communities. It's also important to note that even within the same cultures, in this case, in the South Asian culture, there's a lot of heterogeneity in languages, and that including information in just one or two languages is still not complete and may reduce accessibility to care for many individuals. Lastly, there's a lack of culturally relevant and appropriate care when it comes to addressing overdoses in the South Asian community. This kind of ties everything in together. So with diverse cultures come diverse values, norms, behaviors, meaning that different cultural groups have different needs. In the South Asian community, trust, community mindedness, and spirituality are revered as ways of promoting well-being. And these must be taken into account and included in care that is culturally sensitive and relevant for South Asian people. Culturally relevant care also considers that even within one cultural community, there can be differential vulnerability. So, for example, in this article that we saw earlier, it's important to realize that Punjabi international students in the South Asian community might currently be at higher risk than the rest of the community for a number of factors. And so these are all really important to consider when designing culturally competent healthcare that is adequately meeting the needs of different communities. I will note that Fraser Health has the Roshni Clinic in Surrey, which aims to offer this type of culturally competent care, catering to South Asian adult populations dealing with substance use disorders. However, it's also important to highlight that this is the only such clinic that is publicly accessible in all of BC, despite Surrey being the second most affected region in BC and the South Asian population being disproportionately affected. So this lack of culturally competent care due to government neglects often results in disproportionately increased disease burden on affected communities. And as we'll discuss a little bit further with Gurkirat and Kulpreet, there's, where the government and health organizations should bear the responsibility of caring for individuals dealing with substance use and overdose, the onus sort of falls on the affected communities to handle this crisis. And as reported in this article, for example, the responsibility of handling the deaths of several international students due to the overdose crisis has led to or has fallen on gurdwaras or Sikh temples in Surrey, which have spent hundreds of thousands of dollars to send back the bodies of individuals or students who died of overdose back to their families in India. And these are the same students that are exploited and pay universities, up to 4 times more in tuition than domestic students, only to receive no sort of adequate mental health resources or culturally competent care in return. And in the absence of this care and consideration by the government, it's the grassroots organizations, nonprofits that are paving the way to address BC's overdose crisis in a way that is culturally relevant and sensitive. And these nonprofits are often community-oriented, aligned with these collectivist ideologies of many cultural groups outside of the Western world, where the community acts as one to sort of allow for this interdependency and care without self-interest. Unfortunately, this again serves to disproportionately burden the communities that are most vulnerable within the overdose crisis, because often these nonprofits are led by members of the affected community. And so in the case of the emerging crisis among Punjabi international students, it's the students themselves that are taking the initiative to address substance use and overdose in the community. With that, I would love to introduce SOUDA and Gurkirat and Kulpreet, who's with the South Asian Mental Health Alliance, to speak a little bit more on their experiences and the work they've seen and the work they've done and the impact that they've perceived, and just what more there is to do.
Thank you, Harjeev. So SOUDA stands for Students Overcoming Substance Use Disorder and Addiction Society of Canada. SOUDA is a non-profit student-run organization founded by international students tackling overdose crisis since 2019. So what we do at our outreach booths and community outreach is ending stigma and building capacity through community outreach, also introducing harm reduction skills to vulnerable populations, people in construction, trucking, people who are new immigrants, international students, and also people with limited educational background. So we provide culturally relevant and language-specific overdose response and prevention training in Punjabi, Hindi, and English, and also connecting families and people who use substances with appropriate clinics and health resources such as Roshni Clinic in Surrey. So the idea of SOUDA originated after I attended South Asian Youth Mental Health Ambassador training with South Asian Mental Health Alliance. And I would like Kulpreet Singh to shed some more light on the retreat and the dividends it paid later on.
Thank you so much, Gurkirat. I'm really thankful to be here today, and I really appreciate the work that Harjeev and Gurkirat have done towards this really important issue, which is, as you know, a crisis in not only South Asian communities, but throughout British Columbia. The South Asian Mental Health Alliance was founded in 2010. It was inspired by some of the struggles that I had seen in my community and also my lived experience with ADHD. It started with North America's first South Asian community conference, where we brought together community leaders and speakers to discuss this topic, which, as you can imagine, 10 years ago was even more stigmatized and hidden than it is today. But since that time, we've seen a wave of new immigrants and international students coming to Canada and also facing a lot of hardships. And so when we advanced our programming, we started with a youth mental health ambassador training in 2014. But we also wanted to expand that program and make it scalable. So in 2019, we worked in collaboration with the Ministry of Mental Health and Addictions to establish this program and to make it available to more young people. We started with South Asian youth that were born and raised in Canada for the most part in our first cohort. And then in our second cohort, of which Gurkirat Singh was a member, it was focused on international students. And the model for the retreat was to provide a welcoming, non-judgmental, supportive environment where young people can enjoy fun activities, good food, recreation, and then also receive mental health first aid training. And we wanted to customize this training to the demographic that we are working with. So for the youth that are born and raised in Canada, the focus was more in English. For the international students, it was more in Hindi and Punjabi. And we provided more programs for the second cohort that were related to settlement and immigration issues. The third cohort was focused on the Fijian community. And we are continuing to work on developing new cohorts where we can train young people in skills and also empower them to take the learnings that they've got from this training and to become active members of different nonprofit societies. So our goal is not necessarily to expand our organization, but to make young people the pillars of other nonprofit societies so that they can do great work in our communities. One of the trainings that involved this skill building was with the young people who went on to become directors and volunteers in One Voice Canada. And One Voice Canada is an international student advocacy group, and many of the young people who took the South Asian Youth Mental Health Ambassador training went on to become volunteers with them. And then another successful example is before you in Gurkirat Singh, who took inspiration from the training and went on to establish his own nonprofit society called SOUDA. And the same has occurred with the Fijian community. We have some youth ambassadors who are involved in the South Asian Healing Network. So it gives us a lot of honor and pride to create that environment where youth feel safe to build their skills, to learn about mental health, and to go on and serve their communities. So I'll pass it back to Gurkirat to share some of his experiences with outreach and some of the lived experience of community members.
Thank you so much, Kulpreet Singh, for sharing that. Yeah, so as the death toll from drug toxicity was rising, we learned that there were no organizations providing culturally appropriate overdose response and prevention training, especially in the Punjabi community or South Asian community in the lower mainland. So we felt the need to start this program where we can go out in the public and we can help people create awareness around overdose crisis in BC. So So all of our volunteers, including me, we got trained with the regional harm reduction coordinator, Aaron Gibson from Fraser Health. And then we started tailoring this program, particularly towards South Asian community members, and also in a language which people can understand and free of medical jargon. So we focused our efforts on educating members of South Asian community because what we have seen is substance use knowledge is limited due to social taboos and language barriers. So we started offering education, resources, naloxone training, and conversation around substance use in languages such as English, Punjabi, and Hindi to help break the stigma and encourage harm reduction strategies. So we designed culturally appropriate harm reduction and overdose response and prevention training, where people with either like little or no educational background can learn how to save someone's life within like 15 minutes of the training. So since 2019, we have interacted with more than 5,000 community members and distributed over 1,000 of naloxone kits and other harm reduction supplies during our outreach booths, which happens at Surrey, Delta, and Abbotsford parks, gurdwaras, temples, and other places of worship. One of the challenges I would like to share during the pandemic, while adhering to COVID-19 protocols, our volunteers conducted dozens of booths to increase the awareness about drug toxicity, because this was the time when Fraser Health released the report where it showed South Asian community members are impacted heavily with the overdose crisis. So I would really like to thank all our volunteers who, during the pandemic, without the fear of COVID-19, following all the COVID-19 protocols, they went into the community in parks, in open spaces, and started this conversation, started training people on how to save lives, and also introduced harm reduction skills. So I would like to share some of the stories which I have personally heard during the outreach. And since Harjeev talked about stigma being one of the factors which stop people from getting the care they deserve. So we were doing outreach in Bear Creek Park, and I met a South Asian man who used substances with 3 other friends. So I asked him like if they are sharing same needles with each other. And he said, yes, they have been sharing needles with like 3 more people. But when I was informing him about the risks and encourage him to get sterilized needles from us, he said, I cannot carry these needles because I do not want my wife and family to find out that I use drugs. So we can clearly see this is one way in which stigma can endanger lives. So we told him about the supervised consumption sites, and his response was, oh, I never knew that this place ever existed. So we can clearly see people like him are unaware of the available services due to the language barriers. So I think like this gap between the available services by the healthcare and the general public. So we are trying to bridge this gap between the community and the healthcare services. So, and also I met this woman who lost both her husband and son to overdose in COVID-19 pandemic. So even though entire world was facing one pandemic, BC was the place which was fighting 2 battles at the same time. And the South Asian community was also facing this deadly crisis, but it was being neglected by officials, by everyone, and no one was actually tracking these numbers, tracking the actual data. So to address that, so Team SOUDA, along with Dr. Natasha Puri from Roshni Clinic, took this initiative to have first of its own kind study on Punjabi international students to know about substance use patterns in Punjabi international students living in the lower mainland. Because we have heard from the anecdotal and word of mouth evidences, which could be true, which could be false. So whenever we present this somewhere, people every time they ask, okay, so where is the data? Where is the actual numbers? So I'm pretty hopeful that this study, which is in progress right now, will shed some light, will shed some real numbers on the issue, and will help health authorities to form more programs tailored towards international students in a culturally appropriate and culturally sensitive way.